Good afternoon, Ways and Means. It's been a long time since we spent so much time apart. So we are looking at S18 today, which is an act relating to licensure of freestanding birth centers. This was voted out of the Senate, out of the House Healthcare Committee, and now we are picking it up because there are some fees in it. We are going to slightly counterintuitively start our testimony with Lauren from the Vermont Department of Health because this is when she's available to us. And then we will go to Jen Carby and then Nolan from JFO. So Lauren, I'm sorry, you're gonna have to do since you're starting us off, you're gonna have to do a little bit of level setting on why you're even here and what we're talking about. If that's okay with you.
Yes, absolutely. Thank you so much. My name's Lauren Lehman. I'm General Counsel for the Department of Health. And I'm here. Thank you so much for accommodating my schedule. I have a child with a doctor's appointment this evening, and we all know how hard those can be to get. So I appreciate it. I'm here to discuss the fee from the department's perspective for freestanding birth centers. We were asked to consult on this legislation, which would allow for the licensure and regulation of freestanding birth centers, which you'll hear more about probably from Jen Carby in a few minutes. They're essentially places to provide maternity care, perinatal care outside of a hospital and specifically devoted to that level of care. The Department of Health would be involved as the licensing entity, and we would write and also developing the rules for these facilities. And we partner with the Department of Disabilities, Aging, and Independent Living to conduct those surveys and inspections to understand compliance and to facilitate the licensing process. So we worked very closely with the advocates on the bill over on the Senate side to ensure the program for licensing would work. Licensing and regulation was feasible and we could implement it. I'm here today to talk. There's a $250 fee for that licensure. It would also be $250 fee for renewal and $250 fee if there were a change in ownership. So at all those points, there would need to be an inspection conducted of the facility, and thus a fee would be implemented.
Thank you. Do you have a sense of if that fee is going to cover your internal costs for those inspections?
It will not cover the internal costs for the inspections, but we do this work already for hospitals and ambulatory surgery centers, and Dale does this work for nursing homes and other facilities. So we have the staff already, and we think we could do the work within our existing resources.
Okay. And is this fee comparable to fees for those other inspections?
These are a little lower, but we could definitely do the work within we don't anticipate there will be a huge number of them. So I think that will make it appropriate and proportional to the need.
Okay, thank you very much. Any other questions?
Yeah, was that a separate fee for the inspection?
No, that is one fee for the licensure and inspection. It's just that every time they need a license or an inspection and probably a change in licensure, there would be a fee. So the ownership changed and at renewal of that license.
This has nothing to do with OPR.
Nope. Doesn't. I used to be there, but now I'm not.
Right.
Yeah.
So can you remind me, you asked if that fee is enough to cover their expenses?
Mhm.
And the answer was no, but.
But it's not necessary that it does so. Because they are already sufficiently staffed to meet the fairly small anticipated need. Is that, Lauren, I don't want to speak for you, so would you like to repeat your answer to my question? Or
Yes,
will you,
sure.
whether you'd like to or not?
So we would, we are neutral on the fee. I think within our existing resources, we could cover the cost with that additional $250. The $250 will certainly help with the resources needed to conduct these inspections, but we are able to cover our expenses within that $250.
I don't understand. I feel like I heard it's not enough and we are able to cover our expenses. And my thought is, as new entities come on, why not have them more appropriately feed than to put them lower.
It seems like a question for Lauren and not for me, Representative.
Yeah, we don't want to increase the burden or create a situation where folks aren't able to enter the market because of fees that are too high. And when you have a licensing fee and a really small population of licensees, if the burden of licensing and regulation were to fall solely on those licensees, it could be such a barrier to entry that nobody was ever able to get a license. So we try to understand that and work within, we don't need a full staff member for every single institution we regulate. And so, we've done the analysis for these birth centers and what we think the cost will be, and we think we can do it we are sure we can do it within our existing resources.
Representative Brent?
So, first, thank you for spending time with us. I know it's always a busy time for you folks, but thanks for the time you're giving us this afternoon. So who is it that pays this $250 fee?
The person who wants to be licensed as a birth facility. So it would probably be an owner or group that owned the birth center.
Can you give us an example?
Yeah, so if there was a nonprofit entity formed with 3 licensed midwives, and they wanted to be licensed their facility, they would apply for a license, and they would have a facility that Dale would come out and inspect, ensure that they met the regulations and standards for licensure. And once Dale was comfortable with that, they would notify the Department of Health, and we would issue a license. And collect the fee. And every certain period of time, they would need to renew that license, probably get another inspection, that's depending on rulemaking. And we would go out and do the inspection, another fee would be issued, and the license would be reissued for another couple of years.
So they're looking at the facility, at the building, the windows, the water, the cleanliness, all that stuff?
Yes, so they would be looking at all of the standards would be set in rulemaking. They'd be looking at policies and procedures. So the S18 right now requires a transfer agreement with another hospital and then a transportation agreement with EMS. Inspectors would check to make sure that that was in place. There would also be looking at facilities. We'd work with the Department of Public Service to make sure that the facilities met codes. And then, so yes, that would all be part of that inspection. And we'd also provide inspections if there were complaints. The bill authorizes Dale and BDH to inspect at any time. So if there were complaints, we would also have the authority to inspect.
So the midwives and other folks that work there would already have a certificate that they pay their own fee, right? Those who are employed as professionals there.
Yes, so to practice the profession, that would be a different license, but those licenses would not, those licenses do not include inspection of facility policies, et cetera. It's solely for the individuals, verifying the individual's credentials.
Right. So the only fees we're talking about today are this $250 fee per facility, per site. Is there any other fee we're talking about besides that?
No, it's just, it would be the initial licensure, renewal of that license, or say, those 3 midwives wanted to change out who was in their partnership and they switched to 3, they were purchased by another corporation. We would come in and probably do another inspection at that time.
Lauren,
Thank you. Yep, no,
Very
I'm
quick.
thank you.
Lauren, do you have a sense of how this might impact existing births at existing hospitals?
I'm gonna defer that question to, I'm not sure if you're hearing from Lori Fisher or Lori Foster today, and Boz, but they have some great data on that. My sense is that there's disagreement on how that would impact.
Okay, thank you. We will hear from, I'm not sure in any case it impacts the fees, so I'm not sure I think that's testimony has been heard thoroughly in the other committee. So is this related to the future?
Yes,
Okay,
totally.
thank you.
So it's my understanding that if there is a complicated birth at the birthing center, then there is transportation to the hospital.
Yes, there'd be a required policy for transport to the hospital in that situation. There's also requirements that certain procedures can't be performed at the birth center, as well as certain, patients with certain risks would not be permitted to give birth at the center.
So my question about this is, for that transportation, do you inspect that transportation? And does that have to be something that is part of the licensing fee? Do you go in and inspect the whatever vehicle it is that brings people from one place to the next?
They would need to have that contract, that agreement with an emergency medical service nearby. And we do regulate the emergency medical service entities around the state. So we do the inspections through that. And it's a separate, and whatever agreement they have with insurance for payment of the transportation would pay the cost for that transport. But the licensing fees would be borne by the emergency medical service organization.
And are the fees, this is a little, just to make sure, the fees that they pay, are those transport, emergency transport people, are those sufficient to cover the work that you do to inspect them?
Yes, I think we're able to cover costs right now.
Thank you.
Thank you very much for joining us, Lauren. Really appreciate it.
Thank you for having me. I appreciate it.
Take care. Now we're going to learn about the bills. Thanks for joining us, Ben.
Good afternoon, Jen Carby from the Office of Legislative Counsel. So did you like me to put language up or
Yes,
just talk?
please.
Okay. Ready to go. So we are looking at S18 and act relating to licensure of freestanding birth centers. The House Healthcare Committee has sent you a strike all amendment, but the fee part has not changed from what came over from the Senate. This would add a new chapter in Title 18 on birth center licensing. It is modeled in part on language in existing chapters in that title on licensure for hospitals and ambulatory surgical centers. Starts off with definitions, and I don't know how detailed you want to get, Madam Chair, or if you want, it might help to look at the definition specifically of birth center.
Sounds great.
Okay, so this is a facility, the primary purposes of which are to provide midwifery care, low-risk deliveries, and newborn care immediately after delivery for a stay of generally less than 24 hours. The term does not include a facility that is a hospital, is part of a hospital, or is owned by a hospital. It's also not a facility that is an ambulatory surgical center or the resident of the individual giving birth. And a birth center may be located on the grounds of a hospital, but it is not part of a hospital. So this is not a hospital birthing center. That's not what this bill is about. This is about freestanding facilities. Some of I missed the day when House Healthcare took a virtual tour of one, but from the pictures I've seen, they're generally kind of a home-like setting, usually one or two birthing suites, and it is for low-risk pregnancies. You'll see later in the bill, there's prohibitions on performing cesarean sections or epidural anesthesia. So this is really low-risk deliveries, and generally they're staffed by certified nurse midwives, licensed midwives, sometimes physicians, OBGYNs, but it's just a different option for setting for giving birth. Right now, the options in Vermont are at home or in the hospital. This is sort of an intermediate area. And my understanding is that most other states, including our neighboring states, do have freestanding birth centers.
There are birth centers in Massachusetts and New Hampshire within like 30 minutes of my house in Brattleboro.
Yes, and I think some of the witnesses who testified in other committees I've been in have said that they went to those states to use those facilities. Then we have definitions of some other terms that are used in here. Most are not necessary for understanding sort of the basics of what's in here. So you have to get a license. in order to operate a birth center. It may be independently owned and operated by a licensed maternity care provider. That was a defined term. May include advanced practice registered nurses, including certified nurse midwives, licensed midwives, physician assistants, naturopathic physicians with a special childbirth endorsement, and physicians. So it can be independently owned and operated by a licensed maternity care provider or anyone else. But when the question was asked of Lauren, who would pay the fee, it would be whoever is owning and operating that facility. And here's the language I mentioned: a birth center shall not offer or provide epidural anesthesia or a cesarean delivery. And a lot of this is fairly standard language about not using terminology. Nobody can represent themselves as a birth center or use that term in their advertising if they're not licensed as a birth center. Here's the application and fee. So an application will be made to the health department, and each application for an initial license, renewal of a license, or a change of ownership must be accompanied by a fee of $250. So that's the fee that Lauren was speaking to. Fees collected under this section go into the hospital licensing fees special fund, and are available to the department to offset the costs of licensing birth centers. This is the existing special fund where there are various licensure fees go for licensing hospitals, ambulatory surgical centers. So this would go into the same special fund. General license requirements have to file an application, submit the licensing fee, and then the health department does an inspection. Health department or its designee, which in this case is typically Dale, and then make sure that the applicant is able to operate a birth center in accordance with rules adopted by the department. There's some process here for revocation of a license if necessary, and the appeal. There again is the more specific inspection language. The department or its designee must make or cause to be made such inspections and investigations as the department or designee deems necessary. And the birth center, including its buildings and grounds, and as allowed under law, its records are subject to inspection by the department and its designee at all times. And then the department may take action if a birth center is found to be out of compliance with any requirement of this chapter or rules. The department finds a violation. It posts a report on its website with a summary of the violation and any corrective action required. General confidentiality for information received by the department, but that information would not need to be kept confidential if it relates to a proceeding regarding licensure of a birth center, and it also does not apply to the summary reports of violations. A lot of the details come in through rulemaking. Section 2359 directs the Department of Health to adopt rules that are based on the National Birth Center Standards published by the American Association of Birth Centers, and include at a minimum a number of provisions, requirements for operating a birth center, including requirements for safety, sanitation, and health, obtaining, storing, and dispensing pharmaceuticals, consistent with laws, requirement for notice to the Department of Health when there's a change of ownership, scope of services that may be provided at a birth center, including risk factors that preclude a patient from receiving labor and delivery services at a birth center. So that's what Lauren was mentioning about low risk, and certain risk factors would not allow delivery to occur at a birth center. Appropriate staffing, including the types of licensed providers who could practice at the birth center, complaint process, the facility, equipment, and supply requirements, record retention and confidentiality, quality assurance and improvement, corrective action plans. And then here's what was being talked about here toward the end of Lauren's testimony: a requirement for written practice guidelines and policies that include procedures for transferring a patient to a hospital if circumstances warrant. And then requirements for written policies and procedures for collaboration with hospitals, other agencies and facilities, and individuals to provide other services to patients as appropriate. It gives a list of different types of services that might be necessary. And then a requirement that those policies and procedures are provided to the relevant service providers upon request. You can see one of those is transport services. And also a requirement that the birth center provide the health record of the patient or newborn or both to the receiving service provider upon referral or transfer in accordance with applicable privacy laws. No effect on the scope of services that a licensed midwife, certified nurse midwife, or other provider can offer at the birth center or perform in a space that is shared with or adjacent to a birth center, and specifies that a birth center may serve as a location for additional services offered in shared or adjacent spaces, such as outpatient gynecologic care, primary care, education and support services, as long as any licensed provider is only acting within their scope of practice. That's all section 1. Section 2 is a health insurance provision that is just specifically adding birth center as the setting in which the maternity coverage must cover if an insured person under the plan is receiving services at a birth center. Section 3 adds an exemption or exclusion from the certificate of need subchapter for birth centers that would not need to get a certificate of need. Section 4 directs the Agency of Human Services to seek federal approval to allow Vermont Medicaid to cover prenatal, maternity, postpartum, and newborn services at a licensed birth center and to reimburse separately for birth center services, including facility fees and professional services. And finally, Section 5 is the effective dates. So the birth center licensing would take effect on January 1st, 2027, or the effective date of the birth center rules adopted by the Department of Health, whichever comes first. The health insurance coverage takes effect January 1st, 2027. The CON exemption or exclusion takes effect on July 1st, 2025, so that people interested in starting a birth center can begin to do so without having to wonder if they need a certificate of need. And then Section 4 on the request for federal Medicaid, federal approval for Medicaid coverage would take effect on passage, with Medicaid coverage beginning on the later of the date of approval or the effective date of the birth center rules. And then the effective date section is effective on passage.
On the Medicaid coverage, I know that Medicaid covers home birth, midwifery, and hospital, but that like still we would need.
Yes, because under our Medicaid state plan, there's a specific question that asks if we have, if we have licensed, if we have birth centers, because we don't have any, right? So we would need to get approval to amend our state plan to reflect that we do have birth centers and that they would like to include them in the state plan.
And I'll ask Megan what we think about the eventuality of that being approved, or do you have a sense of that?
I don't have a sense, unclear.
Okay. I guess everything about Medicaid.
Yes, it's rather, exactly. It is rather unclear where anything Medicaid related stands in it, including requests for any expansions.
Any questions for Jen? Yes, Representative Brennan.
I think this is a question for Jen, but something's wrong here with the way the fees are structured, because she's got money left on the table.
Let's ask Nolan that.
Sorry.
He's making his way up.
I love that for him. Thank you. Yeah, Representative
I'm
Peatland.
not sure this is a question for Jen, but is the application or requirements any stricter as far as you know than the other states that do have them?
Don't believe they have, you mean the statute itself or the application
Well, I
materials?
guess maybe both. I
I
mean,
don't think the materials have been created yet.
Okay.
I don't have a sense for whether this is particularly stricter. It's not that dissimilar from our other hospital and ambulatory surgical center licensing statutes, although, you know, the scope of services being offered here is much narrower than in those facilities. I do know that the Birth Center Coalition, and we've got Lori from the Birth Center who I'm going to call on if you have specific questions, and the Department of Health worked on coming up with language that both parties could agree on.
great, thanks. And I may have another question later, because again, Copley's, we just had a meeting Monday, Copley's closing their birthing center, so it could be critical for our area.
To be able to have a birthing option. Yes, absolutely. Your question later who are you going to want to address that question to later?
I'm not sure, Jen, any thoughts as to who might answer that question is like,
About whether it's strict, whether what we have is stricter.
yeah, or, and then the next question would be, are there outfits out there that are looking to do that in this?
Yes,
state?
there are. Again, going to Lori from the Birth Center Coalition, but I would love to.
I can have Lori from the Birth Center
Here.
Coalition join us after Nolan.
If she knows far more about birth center.
Any other questions for Jen? Great, thank you. Thanks, Jen. Nolan, thank you for scaling the stairs and joining us. You're pointing at Bill because he had a question I didn't notice. Okay, great.
Counting.
Oh, cool, okay. Thanks for joining us, Nolan.
Thanks for having me. I don't get to come here enough. You guys are so busy focusing on education. You're just totally neglecting us and helping human service.
We are giving it the attention that it requests of us. We appreciate that not much attention has been requested of us this year.
But
Yes.
just means I don't get to spend much quality time with you.
Next year, we'll spend time in pre-K and you can join us.
Can't wait.
Yeah. So what's happening here? I think we have some confusion about the fees not covering the costs. So, but we haven't looked at the fiscal note yet, so maybe we won't have that question once you tell us things.
Okay, well, now I'm frozen here. Okay, here it goes. For the record, Nolan Langell, Joint Fiscal Office. Essentially, this has, as you know, has $250 fee for applications, renewals, and changes in ownership. It would be deposited into the hospital licensing fee special fund, which would be available to the health department to offset costs of licensing the centers. And initial fees from the initial revenues from this fees are anticipated to be nominal and will depend on how many birthing centers actually apply. I have not, no one has reached out to me to say these fees are not adequate. Doesn't, so that's news to me. So, but that said, if you have 3 birthing centers, that's $750. Period.
Thank you. Representative Brennigan, to you.
Yeah.
Yes.
Moment. So the lady who was on before said they have leftover money, cash on hand.
Lauren Lehman from the Department of Health.
Thank you. And that they were going to be able to use that money to help balance the costs. And that $250 was set at that fee because they didn't want to discourage anybody from starting a new birthing center.
Mhm.
They wanted to set the fee low enough so that people would be that way. But see, fees, remember the fee days? Fees are supposed to cover the costs so that
Yeah,
the rest of
they
the
are.
state government doesn't have to kick in so that the people who use the service are the ones paying for it. That's what a fee is. And it didn't sound like that's what was happening here.
If I can clarify, Madam Chair, I think Lauren said they were already staffed to do the work. I'm not sure she said they had surplus funds sitting around.
Yes, that was also my,
That's
thank
right.
you, Jen.
So they have the staff, so they're not paying for the staff. So that translates into money that they would have to give out.
So what I heard, and I'm sorry, Nolan, that you were not here for the testimony. What I heard from Lauren was that they believe they can cover this work with their existing staff that does inspections on other medical facilities, because it might just be 3. That would not be even close to a full staff person from what Lauren said. And so they don't need any real extra money because they're covering it from their existing staff and their existing staff time. Does that line up with what you've been hearing in the health care community?
I haven't heard one way or the other, but I tend to defer to the agencies and departments when they say they need money, or if they say we don't need money. I usually defer to them, especially when they say they don't need money. I think it all comes down to a decision for you guys in terms of what's the funding model you want to use to fund any particular thing, whether it be the AG's office or a DFR or health department.
How much?
That's a policy question for you all.
And Representative Brennigan, I would just offer to you that we do regularly make specific policy decisions that if we think the barrier to entry would be too high because of a certain fee, we lower it. And we do that pretty regularly across the board. We even had a really fun early bird special once, or something.
Mhm.
I don't remember what that was, but I remember being charmed by it.
The other thing to think about is if they're already fully staffed, how much work does it take for them to actually license? You know, it might not be a lot of work,
So why do they need the $250?
probably because they apply fees to all applications. So it's a standard policy.
250 is standard for all these.
No having a fee at all.
contracts.
You asked why would there be a fee at all?
Yeah,
That's because it's standard to have an application fee.
I guess, I think either there's not enough fee being charged, or they're charging too much. Something's not right here. So I'm gonna suggest to the committee we lower the fee.
So I imagine also, the birthing center is a very specific, and I think we should hear from the folks from the Birthing Center Coalition, but I imagine that a birthing center is different in different people's imaginations. And if you don't have any fee at all, you might have, and I want to call them nuisance applications, but incomplete, unprepared applications, right? For someone who has not and the fee does add some weight to the application process, right? It adds a sort of a marginal barrier to entry so that someone actually attends to the work that's required in the application, right? That's one reason that an application fee is sometimes levied. So that's one piece of it. And I heard from the Department of Health that they were comfortable with it, but I'm happy to hear from more witnesses, and we also don't have to vote on this today. We can wait until tomorrow. It's fine if folks want to hear more testimony. Nolan, did you take us through the full fiscal note? And should we give you a chance to do that since you came all the way up the stairs?
All the way from the first floor. Sure, I mean, the only other thing, let's see here is. The only other thing on here, which is section 4, which is it's a Medicaid issue, which basically requires AHS to seek approval from CMS to allow Vermont Medicaid to cover prenatal, maternal, postpartum, and newborn services provided at a licensed birth center, and allow Medicaid to reimburse separately for birth center services, including birth center facility fees and professional services. Just to get a sense, between 2021 and 2023, Vermont paid for an average of 2,033 births per year. So the fiscal impact and the potential for savings to the Medicaid program would depend on the timing of when the birthing centers come online, when CMS says, yes, you can reimburse for that, and then what is the actual utilization rate? So of that 2,000 per year, how many folks actually use it? And then the final thing we think about, is it cheaper for folks to be at a birthing center than in the hospital? So there's multiple things that go into it, but that's why I say, the evidence suggests that there's potential savings on Medicaid, the Medicaid program and the state employee health plan, depending on access to those centers. So right now, there are none in the state. If you want to go to a birthing center, I think there's 3 in New Hampshire that Blue Cross Blue Shield covers on a state employee plan. What the utilization of those centers is, and once they come online, so it's timing. So the answer is there's no immediate fiscal impact, and the impact might not be an increase in cost. It could be a decrease in costs. We don't know. So that's the.
This was one of the recommendations, I believe, in the Oliver Wyman report, which was focused on trying to get care into lower cost settings where possible. And this would be an example of one of the strategies to reduce costs, but also let people deliver in the way they want as well. And I think that last piece is really important, because if you don't have that, then people who need the support of Medicaid can't access this lower cost option.
Oh, yeah.
I'm sure I came in late and I apologize. This was covered by earlier testimony, and I'm just trying to think if other states, you're aware of the experience of other states that actually do then stand up with the birth center licensing program with the effective spend.
I'm not the one that could speak to that. Sorry.
It can't be the first.
No. But I don't have the answer for that.
I think one of the reasons we're moving forward with this is because we are
We're not-
very far from the first.
Yeah.
Yes. Thank you very much, Nolan.
Well, thank you for having me.
I very rarely do this, but you are not on the agenda. Would you like to join us anyway? Thank you. Oh, sorry, you have a question for Nolan?
Yeah.
Yes.
Please. So what I'm trying to understand is this, that's a The Oliver Wyman report said that, yeah. So if you have choice because you're a low cost, you can do something because you're a low risk person, then you choose this option. And then if you have high needs, you have to go to the hospital. And Medicaid does not reimburse the full amount at the rate that commercial insurance reimburses. So in your fiscal note, did you address what happens to the hospital?
No, because that's a larger conversation, right? So right now, they're getting those reimbursement rates for those births currently. So if the birthing center happens and it's a Medicaid beneficiary, taking that cost out of the hospital and putting it into a lower cost setting. So are you saying that the hospitals are losing Medicaid money?
Don't know. I'm just looking to you for an analysis. Those are my questions. I don't know what happened.
Some of them are also attached to hospitals or near hospitals.
Yeah, I think, I gave birth at the UVM Medical Center and we had a nurse midwife practices attached to the doctors and I gave birth with midwives all four times.
So
I think you can give birth with a midwife in a birthing center at home or at a hospital.
Yes.
But I feel like we're getting a little.
I know,
far
I'm
off
just,
these
this
skis.
is what I'm just, it's about fees.
Yeah.
And I'm just trying to understand what the impact is on hospitals when.
So I think you'd have to talk to the hospitals about that. I think they've testified on what this might do for them or to them or whatever, but my fiscal notes tend to focus on what's the impact to the state budget. In this,
No. I think we are not going to vote on this today, and I'm going to let committee members with outstanding questions to go talk to the healthcare committee and let me know if there are other witnesses that you want to hear from that we don't hear from today. And maybe have a reporter of the bill from the health committee join us as well. Would you like to join us? Thank you very much for allowing me to put you on the spot that way.
So for the record, I'm Lori Foster. I'm a certified nurse midwife. I'm currently the legislative liaison to the Vermont affiliate of the American College of Nurse Midwives, and I'm also a member of the Vermont Birth Center Coalition. We are definitely, very much in support of this bill, and for many reasons, that it gives another choice to Vermont families for a birthing option. It does achieve the triple aim, which is lower costs, better outcomes, and higher satisfaction. And I'm happy to answer any of the questions that have come up. Do you want me to just field some of the ones that?
Yeah, that would be great.
I heard? Okay. So, there has, I think probably one of the discussions that's come up numerous times, which someone asked today, was whether or not this is going to have a negative impact on hospitals. And I think that the reality of birth centers is that they are very much a labor of love. It takes a fair amount of money to start one up. They're not money makers. As we know, a lot of the hospitals are struggling with their maternity units because of the reimbursement structure, and that the way that hospitals or anyone is reimbursed for maternity services is difficult to cover the cost. So it's very unlikely that this would have any impact on the hospital, or if it was, it would be very small. A large hospital like UVM, practically nothing. A smaller hospital, a birth center in a more rural area would likely serve, probably an average of 4 to 7 families a month. And most of those people, not all those people are going to be people that would have otherwise lived in a hospital. There's going to be people that would have had home births, people that are traveling into New Hampshire and Massachusetts to have birth center births because they can't do that here. So I think, we've looked at the numbers. There's not a way, unfortunately, there's not a way to actually say what is the exact number, because no one knows how many families will use the birth center, where they'll, where they will occur. Our estimate is in the next several years, once the licensing is available, that, possibly 2 will pop up in the course of the first several years of the licensing. New Hampshire, which has had birth centers since I moved to Vermont in 1982, and there were birth centers in New Hampshire then. So since 1980, has 5 birth centers. And they do have a bigger population. In Massachusetts, they just passed a big bill to support and actually fund birth centers because because of the maternity care crisis and trying to provide, more options for people and trying to lower costs. We're obviously not asking that, we're just hoping for the licensing to be able to manifest this as a choice for Vermont families. The cost here, actually Blue Cross Blue Shield made this handout. I don't know if anyone of you have seen this, but it's comparing costs of various services at Dartmouth, at UVM, community hospitals, and freestanding facilities. So vaginal delivery at UVM is $17,000, Dartmouth $11,000, community hospital $6,900, and freestanding birth center is $2,800. So the cost savings to the state and people is significant. And that's just to be clear, that's the facility fee. Okay, there's also a provider fee that tends to be not quite as different facility to facility. Does that make sense?
Yep.
Do you have any idea how many are waiting in line to get licensed if this is approved?
I know there's one person who is definitely ready and wanting to open a birth center. And I think there are maybe one or two others that, are thinking about it, Yeah.
Anyone else?
Yeah, just the impact in other places, there's only 5 in New Hampshire, that's amazing.
There's 5 in New Hampshire. It varies across the country. There's some states that have a lot,
Yeah.
and others that don't, but we are one of only 8 states that has none.
Yeah.
So, it's a option that's been available across the country. And, to the question of, whether what we would be asking, in terms of the application and all, would it be more strict or less strict? In the statute, it does state that the rules and regs would be developed with the guidelines of the AABC, which is the American Association of Birth Centers. And this is a very, well-run, developed organization that has lots of data that's been, they have all kinds of toolkits, for everything, for opening a birth center, for legislators, for people, promoting licensing estates, so that they, we don't have to reinvent the wheel, I guess, is the answer to that question. That obviously Vermont, the Department of Health wants to be able to, do it their way, but they also, it's not going to be this really laborious process because most of it's already done, and they can just go through that, see if they want to make any changes or tweaks, and that's how the statute's written. Yeah.
Representative Higley, do you have a question?
I'm good.
You're good? Okay, great. Okay.
Thank you.
Thank you very much for joining us and for
Yeah.
jumping in and
I'll just say also, like, the fee, I think is,
thank you.
I think that the coalition certainly thinks that's very reasonable. The idea of making it really much higher is challenging because it's already going to be, economically challenging to get a facility like this rolling. And generally they're opened by midwives. I mean, anyone can open one. Not everyone can practice in one, but anyone could potentially open one. But, they're usually opened by people who are interested in providing the option, and not people who want to make money, because there's a lot of evidence that that's not likely to happen. Thank you very much.
Thank you very much.
Great, thank you.
Do you want some time? You're welcome to it.
I'm
If you do.
just wondering about lowering the fee. If they don't need this money, we shouldn't charge, because somebody has to pay it. So
My vast experience with the administration is that if they want a fee lower, they ask us to do so. But
I think my
Yeah.
impression here with this whole thing is they haven't really thought about it.
okay.
And that it's been so long since fees have really been studied
Mhm.
that they're just pulling a figure out of the air. And I know I'm the only one who goes back that far, but it just,
Don't leave poor Representative Maslin behind.
yeah.
As long as we're just talking
We're
about.
not, wait, I wanna make sure. Let's go.
So
So,
fees for our little show that we're doing, you know, and it's.
so, okay, we're not also. Stay focused on the bill. So, I think if we are contemplating lowering the fee, then I think we need to talk to quite a few more people. And I think it would be very helpful to have a reporter from, you don't, you're good.
We're good.
Okay, okay. Representative Odie, do you want time to talk to the healthcare committee or are you
No,
okay?
I-
Okay, great. Okay. So are folks good voting now on this bill? No one needs to take more testimony.
Good.
Great. Okay. Jim, do you want to tell your fee story now or do you want to wait until after we're done with the bill?
Fee story, but let's do the vote if we're gonna do that.
Delightful. Okay. Someone please make a motion on S18.
I make a motion.
What is your motion?
My motion is that we pass
S18.
S18 as presented to us.
Thank you. Representative Holcomb moves that we find S18 favorable. Is there any discussion? Seeing none, clerk, could you please call the roll.
Lovely. Representative Brannigan.
Yes, with an exclamation point.
Don't do that.
Representative Burkhart, that's me, votes yes. Representative Feltes.
Yes.
Representative Higley.
Yes.
Representative Holcomb.
Yes.
Representative Kimball.
Yes.
Representative Maslin.
Yep.
Representative Odie.
No.
Representative Wazazak.
Yes.
Representative Canfield.
Yes.
Representative Kornheiser.
Yes.
And we have found the bill favorable, 11-1-0.
And I, no,
I'm sorry, 10-1-0.
thank
Sorry.
you. 10-1-0.
Not working.
And I just wanna, I have concerns about how this is gonna play out in my very particular corner of the state where we are surrounded by other birthing centers and have a hospital with a very strong birth center that is also has a fairly low number of births. And so on the overall bill, I'm not entirely sure about the policy direction and I think the fees are appropriate. And so I'm voting yes, but I just sort of wanna say that particular little piece of the puzzle for the record.
So Madam Chair, wouldn't that preclude them from wanting to set up one in your area?
I don't know. I'm just like, I certainly have not had the time or energy in the last 2 weeks to dig into this sufficiently. So I want to be like, I'm still a little uncomfortable and I'm voting yes because I think the fees are okay and that's my job. With that, Representative Brannigan and your exclamation point, would you like to report the bill?
I'd love to.
Wonderful. Thank you. Okay. With that, your charming story, and then we are done for the day.
Great. This.
Well, thank you.
And we